Okay, here we're going to talk about mast cell tumors. And the reason I chose this subject is actually because my mastiff that I was out a little over a year ago now, about 6 months after getting her, she developed one of these tumors on her leg. It was pretty upsetting being that we had just gotten her, but it worked out fine. It ended up going away. It was a grade 1 and not really an issue at all, but of course, not fun to find on your puppy. So here we go. Let's talk about it. So the etiology and the pathology behavior of the cancer. Generally, these are found on any area on the skin of the body, so you can find it pretty much anywhere. Feet, legs, arms, anywhere you can find it. The causes are unknown, but it's most likely mixed. It can be several different reasons, such as hereditary, genetics, and mutations that can occur. A lot of it is epigenetics. I think from what I've read, this is where the majority of it comes from, which happens with a lot of cancers. There's a lot of studies on epigenetics and how environmental factors affects things. You think of some of the areas in the United States where they have found uh, clusters of people with cancer, but it's more than just that. It's also our health. So if you have an overweight dog or cat, this can affect things, and it has to do with turning certain genes like your oncogenes on and off, and your tumor suppressor genes. So that's a pretty interesting subject, but a whole other subject in itself. So we won't go into that further, but these are some of the causes, but again, it's mixed, so it can be one or all of these. Here we have incidence and risk factors. So they're most common skin tumor in dogs. So around 20%, which is a good decent amount. Luckily, these are pretty obvious to spot when they're on the skin, so they get noticed a lot sooner than perhaps some other cancers. 20% in cats, but 90% of those are benign. So that's some pretty good odds. Uh, and the risk factors have to do with, like anything else in our health, is age, the breed, neuter or spayed. This affects things because of hormone levels, weight, and then overall health. Now, over to the right here, I thought this was really interesting because it breaks down a study that was done based on breed and mast cells. And it appears that boxers, golden retrievers, and Weimaraner's, I'm saying that wrong, I know, and labs as well often have mast cell tumors. So those are breeds that you want to keep an eye on when they come into the clinic. If there's any lumps or bumps, that's obviously something you want to keep in mind for those breeds. So the risk factor, obviously, the big one is if it metastasizes, and if this happens, it's obviously traveled through the blood system, the spleen, liver, and lymph nodes, and this can lead to additional systemic disruptions as well as just the cancer. So you can have other symptoms as well. Some history and clinical signs with mast cells being mostly on the skin, it's visual. So you're going to see these lumps and bumps, or a client might be playing or petting their pet and find all of a sudden a lump, and this is where you would need to do further testing. It can be small or large. It can be neat, clean, or angry and ugly. As you can see in these photos, we have one that just looks like a nice clean one, small, fairly small. And then you obviously have this giant one on the side of this dog that just does not look happy. And we'll talk about this more further, but being these are mast cells, there has to do with the immune system and degranulation. So with that, you can have red and ulcerated or swollen um, lumps and bumps as well. And obviously, those are the angry uh, mast cell tumors. So problems, it really depends on the location of the bump. Because obviously, if it's somewhere near the hock or under the toe or on the foot somewhere, these can impede the dog or cat or really any animal. Um, if they're anywhere near the mouth, this can cause problems with eating or breathing, on the nose. So it really depends on the location. With my dog, particularly, it was just on the hip and it didn't affect her at all. She hardly noticed it. Every once in a while, she would lick it. I'm sure it became itchy and at times, but we just kept her from itching it, and eventually it just went away. Oddly enough, though, there is I wish I had put a photo of it in this presentation. I don't have one currently, but she has a patch of brown fur there now. She is a tan dog, but now it's a dark brown patch where that tumor was. So you can tell there was some genetic mutation there in terms of her hair color. That was a side note, but there is, with mast cells, as I mentioned, there's degranulation that occurs. So that's where you end up with the swelling and redness that can occur. Problems would be if it was released into the bloodstream. This is where early detection is important. Systemic disruptions can, if it does enter the bloodstream and the lymph nodes, you can have ulcerations, bleeding, not blooding, swelling and redness at the tumor site. These particular symptoms obviously can lead to even further complications, such as blood pressure drop, which eventually leads to shock. But those are obviously severe cases where things were not treated in the proper time. Diagnosis, it's what you would expect for any type of skin tumor. It's an needle aspirate, or a biopsy, where you look under the microscope and see what's going on there. Further testing is important, especially with mast cell tumors, because we're talking about the granules that can release things that affect the systemic system, like histamine and such. So to determine the patient's overall health, you need to run these tests in addition to a needle aspirate. You can do the lymph nodes as well to see if there's anything where it's metastasized and gone into the bloodstream. Abdominal ultrasound to see if there's anything going on inside. Bone marrow aspirate is a good indicator. Obviously, those are severe cases. And then CBC and chemistry panel, where you can take a look at the liver and the kidneys and all the blood issues going on that might be indicators of some kind of problem with the mast cell. Urine sampling as well. This can be good for liver and kidney identifiers. These are malignant grades. Now, I thought this chart was really helpful because with mast cells, they're obviously, for the most part, unless they are grade 3 here, they're not really that disturbing to look at. So it's good here to kind of get an idea of exactly what grade you're at based on the way it looks. And obviously you're going to get this information by looking under the microscope and seeing what the cells look like. A lot of this info, you can't look at the tumor just visually on the patient and determine this, but you're going to look for cellularity and the location, obviously, but high cell counts obviously isn't very good. Distribution, whether or not the shape is, if the shapes of the cells are all kinds of crazy, then you would be leaning towards more of a grade 3. The nucleus, how funky it is. Again, we're talking going from grade 1 indicators to grade 3. We're really talking about going from this could be bad, to that thing looks angry. So, that's kind of where we're at with these. So you can make your judgments. I think the hardest would be grade 2 if you're kind of in between and you're not really sure. This chart would help you determine that. Treatment, the most common is a combination of therapies. So you have surgery. That's obviously your number one with cancer. You want to get those cells out, especially if it's very localized, which mast cell tumors tend to be early on. You want to just completely cut it out. Now, with my dog, actually, it was so small of a spot that the vet actually thought it would go away. So we ended up leaving it, and eventually it did go away. But she is being continually watched for this condition. But it can be a combination of therapies is your better option on top of surgery, because then, especially for higher grades, because then you're going to get it. Obviously, when you go into radiation and chemotherapy, you're looking at much more advanced processes. For something that is just a small localized tumor, you want to opt for surgery more likely, just to get all the cells out of there. Some considerations, again, you want to consider the grade, and then the completeness of the surgical margins. So that is important, obviously. There's different types of margins you can go around a cancer cell or a tumor, and you want to go as wide as you can. Obviously, you're talking about more scar tissue and a larger, cosmetic issue. So it depends on the client and how they feel, but you really, for your best option, you want to just go in and get a big chunk around it and get that thing out of there. So stage, obviously, same as grade, and you want to look at if there's other locations. That's something to consider. And then the patient's overall health and age. That's important too. Prognosis. So it really depends upon a couple things: your grade and stage, and your completeness of surgical removal, as discussed before. And then you really want to get a good history of the patient as well as a physical exam before you go into your options, because if this is a patient, say, maybe early on, like my puppy had this mast cell early on, years from now, if we find one, well, that could be an indicator that something didn't completely go away, and now we have a problem of it possibly has spread. So in this case, you would want to go with a higher level of treatment than just, say, removing a tumor. So those are things that you really need to get a good history on to understand this patient, and if he or she has had any other incidences. Early detection and treatment is key. That's pretty obvious, I think, with any cancer. If it's detected early, it's a good prognosis, depending on the above risk factor or factors that I discussed previously. And if it's spread to the lymph nodes and other areas, obviously it's poor. And in those cases, you want to make comfortable and provide the best quality of life as long as possible. In terms of time and success rate by grade, grade 1 and grade 2 are rated excellent prognosis. So this means that it's very likely that within 3 years, I believe they mentioned, that there would not be, you would not see a tumor occur. So you're fairly safe to not have a reoccurrence at all. I think 90 to 95% is the number they gave where you wouldn't see a reoccurrence. Grade 3, this is the situation, as mentioned above, where you would want to make the patient comfortable because the prognosis is poor. And it's guarded. Obviously, patients or clients are going to do the best they can, and depending on their financial situation, take care of it as best as possible and try to remove it. But when it's this stage, you really want to just make the patient comfortable with pain medication, as we discussed previously this semester, things that'll just make them as happy as long as possible. And in terms of time, it really depends on the how metastasized it has become. It can be, anywhere between, it depends on how advanced it is. It can be a couple months, maybe a year or two. It really depends on where the animal is at. So you really just have to make them as comfortable as possible and work on just making them happy. And here are my references. If there's any questions, please comment in the post. Thank you.